Hello, I'm Rico Cavella. Welcome to Fearless Aging, where in every episode, my guests and I, we strive to offer you proven tips and strategies that you can implement immediately to greatly improve your overall health and well-being. So we're here to inspire you and empower you to become your best self so you can go out and make a bigger positive difference in the world. And we definitely need more people to do that these days, especially these days. Okay, so the title of today's episode is it's really a good one, a really important one. It's how conventional medicine is making you sicker and what you can do to save your own life. So our expert guest today is Dr. Robert Lufkin, MD. He's a physician, a medical school professor at UCLA and USC, and New York Times bestseller of Lies I Taught in Medical School. He focuses on applied science of health and longevity. After reversing chronic disease and transforming his own life, he's making it his mission to help others do the same. He is the author of over 200 peer-reviewed scientific papers, 14 books that are available in 11 languages, and his weekly video podcasts and social media posts have over 400,000 followers worldwide. So, Dr. Robert Lufkin, thanks so much for being here.
Hey, Rico, thanks for having me. I'm a fan of your work and your program, so it's an honor and a pleasure to be here. This is
Well,
going to be
thank you.
good.
Yeah, we had you on our podcast. I guess I don't know, maybe 6 months ago, and I think it was one of our most uh, looked at or listened to podcasts. So this is our TV show here. So we want to get the important message that you have out to as many people as we possibly can. So, well, let's just start by how did you decide that you needed to write your book, Lies I Taught in Medical School?
Yeah, it's a great question. I'm first of all, the book is critical of Western medicine, but I have to admit I'm part of the problem. I'm a medical school professor. I'm in the thick of Western medicine, but I came to be critical of Western medicine when I came down with four of these diseases, and for the diseases that are in epidemic proportions in the 21st century. Western medicine is no question in the last century, in the 20th century, has transformed our lives. It's made the world truly a better place. The pills, the surgery, and public health measures are nothing short of magical. The problem is in the 21st century now, we have this wave, the tsunami of chronic diseases, all the way from obesity, diabetes, hypertension, polycystic ovary disease, cardiovascular disease, cancer, Alzheimer's, even mental illness. And these take up to 80% of our healthcare expenditures. And when Western medicine applies the same pills and surgeries that were so effective in the 20th century, an interesting thing happens. They may be life-saving in the short term, and they often control the symptoms, but they usually don't do anything to arrest the underlying, what's called root cause of the disease. So the diseases continue to progress. And the way to stop these from progressing, and this is what the book is about and what I discovered myself, was through lifestyle changes. And with lifestyle changes, in my case, I was able to get off all the prescriptions that I was on and literally reverse and arrest these chronic diseases. And now I've made it my mission to get this message out to as many people as I can. And so hopefully they don't make the same mistakes that I made.
Yeah, well, I'm so thankful for you. I mean, it's such a great message, and we in the holistic health community for a really long time, we know that, what's still called alternative medicine really should be mainstream medicine because, as you know, only the body can actually really heal itself when you get it back into balance. And so all the therapies like homeopathy and herbs and just all different type of healing modalities that were used pretty effectively for centuries and centuries. Big pharma just came in and just pushed them out of the side, right? And so mainstream medicine, allopathic medicine, is what should be alternative, right? So sometimes it can save your life, and especially if nothing else works, that's an alternative. But we got it backwards in America. All these natural healing modalities we should try first, and then drugs and surgery and all these other things could be an alternative. You agree with that?
Absolutely. And that was one of the things that really opened my mind up in writing this book because I'm a medical doctor, right? But I realize now that doctors don't make me as a patient healthy. Doctors only make me less sick.
Yeah.
I want to be healthy. It's the lifestyle changes that I control myself that in many cases are more powerful than any pills or surgery I will be given as far as influencing my risk of these chronic diseases. And that's really been transformative for me.
Yeah, it's no question about. Yeah, we know now from, science has shown that our genetics only play a small role, maybe 10, 15% of how healthy we're going to be and how long we're going to live. And it's really, we know it's lifestyle. It's our unhealthy lifestyles, which we're going to talk about. And I want to get what you think the most important lifestyle things that we need to change. So it's primarily lifestyle. So it's just a matter of people getting educated and realizing that they need to take responsibility for their health. Because again, don't you agree that what we really have, what we call healthcare, is really a sick care system?
Yeah.
They don't try
And
and prevent it.
yeah, and just to amplify what you said about genetics, certainly genetics really play a small role in most of the diseases that we face. They're contributory, but they're by far outweighed by the lifestyle choices. In fact, there's something called epigenetics, which is this is a mechanism that controls the expression of our genes. So whatever genes we have, we can control how they manifest through our epigenome. And the way we program our epigenome is with lifestyle. So
Yeah.
literally, the lifestyle directs our genes in many ways to either have a healthy or a less healthy outcome.
Yeah, well, I think also our genes are also affected by both external environment and internal environment, right? So we're affected by all these toxics and all this toxic environment that we've created that we got to clean up, and then also we got to clean up our lifestyles of how we take care of ourselves are huge factors. Well, uh, so, so, so talk about what are some of the well, in your book, which we're going to let people know how you can get a free chapter and how you can also get a copy of your book, The Lies I Taught in Medical School. What are some of the biggest lies that you want people to know?
Yeah, I mean, it's sort of the overarching one that plays a theme throughout the book, and that applies really to all the chronic diseases that I just mentioned, is that the pills and surgeries that we're given in many cases don't control the underlying progression of the disease, and the
Yeah,
disease continues to get worse. They may control the symptoms, they may make us feel better, but they're not really the answer in many cases. And that's a problem because lifestyle, on the other hand, in many of these situations can control the underlying root cause, which we talk about as metabolic disease. Most adults have at least one of these chronic conditions, and most adults have metabolic disease as the driver of this. In fact, many people have multiple of these chronic diseases. So it's sort of normal to be sick in America, and that's not the way it should be.
yeah. I like to say that exactly what you said. I like to tell people about if you just buy into the mainstream narrative that that's just the way it is. We're all going to get old and sick and maybe die in our 70s like most everybody else. Well, if that's what you believe, that's what you're going to create in your life. So not only you got to change your mindset first of all. You got to believe that you can stay healthy and live longer, and that you can take control of your lifestyle. So you got to change your mindset first before you then change your lifestyle, right?
Absolutely. And these diseases, I mean, the diseases I listed, it's a fairly short list, but these chronic diseases, for better or worse, for me and you and most of our listeners, will be the reason we die. They literally determine our longevity because statistically, these are the most common killers: cardiovascular disease, cancer, Alzheimer's disease. So we're all going to die of something, right? No one gets out alive, as Jim Morrison said.
Yeah.
but but the idea is to push them later and later. Why die at age 50 or age 65 or age 75, or why die at 95? We want to push these as late as we can through controlling our metabolic health. And that's the secret to lifestyle. And the other thing that kind of blew me away in writing this book that I wasn't aware of. I mean, as a doctor, I used to think that a disease started when the doctor says I have the disease. Like you
Yeah.
walk into the doctor's office, he says, "Oh, guess what? You've got diabetes," or "Oh, you forgot your keys. Well, you now have Alzheimer's," or "Oh," And I'm not trying to make light of any of these very, very serious diseases, but the point is that even though the doctor has clear cutoffs when these diseases start, the truth is, the reality is that these diseases actually start years to decades before the doctor diagnoses them. And I'm a medical doctor. That's what I do for a living. I know. And the problem with that is, if we wait until the doctor says, "Oops, you've got cancer," or "Oops, you've got high blood pressure," or "Oops, you've got Alzheimer's disease," we've missed a huge opportunity for prevention. Mm-hmm. In other words, the lifestyle changes that are so effective in slowing down and in some cases reversing the disease, the earlier we apply them in our lives, the more powerful they are. So we really shouldn't wait until the doctor tells us something, because the game's not over, but we're at a distinct disadvantage compared to if we started this when we were healthy. I mean, I have a friend who's, he's 80 years old, and he said, "You know what? My doctor says I'm in perfect health. My labs are all normal. I've never taken a prescription drug for anything. I'm great." I go, "Oh, that's wonderful. Congratulations. Let me see your labs." And I look at his labs, and they're all kind of going up like this, and they are still normal. But the problem is, no, we don't want to be normal in today's world, because normal is having chronic disease. And his labs, although they were in the normal range, they weren't really in the optimal range. Mm-hmm. And so the doctor hadn't diagnosed diabetes yet, but he was on his way there. He was on his way to other things as too. So the point is, just because the doctor says you're healthy doesn't mean, and they haven't diagnosed anything yet, doesn't mean we don't have to pay attention to lifestyle, and we have to care about these diseases, because they are brewing in all of us, for better or worse. Even though we may not even have any symptoms yet, now is the time to make these lifestyle changes that can be so powerful.
Yeah. Well, before we talk about those lifestyle changes, some of the most important ones, I just want to say, I want people to know, we shouldn't be blaming too much on medical doctors like yourself, because first of all, you're not taught about prevention very much, or nutrition in medical school. And I'm wondering what you think about that, when that's ever going to change. And also, I really put the blame on big pharma primarily, because they just came in. All they care about is how much money they're going to make, and they don't want you to get well. So they just came in and took over, and it just made it, and just almost, I think they just took over the whole medical system, right? And said, "This is what you're going to do. Here's the drugs. Here's what you're going to do." And so that's just what happened, right?
Yeah, no, that's absolutely true. I mean, people complain about nutrition science and dietitians, and my mom was a dietitian, so I was raised in that kind of environment. People complain that nutrition science, dietitians are taught basically by junk food makers, by big food.
Yeah.
Well, it gets worse. Medical education is really funded by pharma, big pharma, and that's what could go wrong with that. And you say, well, doctors don't work on prevention. Well, the problem is the system, the incentives are not in place for prevention. If I'm a surgeon, I get paid on how many operations I do, not how many people I keep from having an operation.
Yeah.
And that's a problem. And it's no shade on surgeons or people in general. I truly believe in my heart of hearts that healthcare workers, and really most all of humanity, at their heart, people don't wake up wanting to hurt someone else, and they don't intentionally want to do harm. Right. But there are conscious and unconscious, insidious, pernicious financial and other incentives that drive our industry now, so that recommendations are being made by trusted medical institutions like the American Heart Association, American Diabetes Association, that, in my opinion, are wrong and are harming people. And what are some of the reasons for that? Well, there these companies, these institutions are sponsored heavily by companies that benefit from certain information getting out and certain agendas.
Yes, no question about. Well, I mean, isn't that the problem with our whole society? It's based on greed. It's all about the money, unfortunately. And like it's like you said. I think most people go to medical school with really the intention that they want to help people. And you know what? I think because health is such an important factor. It's the most important factor in our life. If you're not healthy and energetic, how successful or enjoyable can your life be at all? So I think medical school should be free. Isn't that one of the problems that most medical students, they have such a huge cost from being going to medical school, that they have to rush and see as many patients as they can so they can pay for their loans and all those things. So I think medical school should be free. That's the most important service that we have to keep the people healthy.
Yeah, I think lowering the cost of medical
At
education
least lower.
helps a lot. But I think at the root, it's getting back to what we said. It's not. I mean, in some cases, it's access to medical care. There's no question. There's some limited access, but the problem is, if medical care is wrong or incorrect, if it's given the incorrect advice, then
Yeah.
lowering the cost of medical care or increasing access to wrong medical care
Yeah.
isn't going to do any good. Like, there's a big move to lower the cost of prescription drugs, which is interesting. But if prescription drugs aren't the solution, and they are, be clear, they are the solution for many things, and I'm not advocating anyone discontinue their prescription drugs without talking to their doctor. But for a lot of these chronic diseases,
Yeah.
the drugs they're given are not the right thing. They can be life-saving and help with symptoms, but they don't address the root cause. So the solution may not be in lowering the cost of medical care, but it may be in empowering individuals about the importance of lifestyle. Because, hey, I'm a doctor. I can't make you change your lifestyle, and the fact of the matter is, as a patient, I know if I go into my doctor's office, would I rather get a pill, or would I rather get a lecture about, what I
Yeah.
need to eat, what I need to sleep? Well, hey, I'm lazy like anybody else. I'd rather get a pill, right?
Yeah.
The problem with that is the pills don't work. They may
Yeah.
make you feel better, but the disease crunches on at a basic level. So,
Well, plus they have all the side effects as
and
well.
the side effects. Yeah.
Yeah.
And so I think lifestyle is the key. And I'm not sure we can look towards the medical establishment, certainly the current healthcare establishment, to deliver the lifestyle that we need. It's something that we have to do ourselves. We have to realize it. Certainly they can help us, or we can help them, but it takes engagement by the patient. And, if you think about it, for me to take a pill, for someone to give me a pill, it requires practically zero commitment on my part. I do it once a day. I take a pill, and then I go back to living my life however I want.
Yeah.
Even surgery, hey, I may have to miss a day of work and, take off a week, but then I go back to my normal life. That's relatively small commitment. But for me to change my lifestyle, it changes who I am. And it shouldn't be, it shouldn't be a punishment. It shouldn't be like, oh, I'm on this diet. No, I'm not on a diet. I'm eating the way that I want to so I can live to see my kids' grandkids. I'm eating the way, and I'm exercising and living my lifestyle the way I'm doing it, because I want to honor myself and my family and my loved ones and be the best person, live the best life I can. But right now, our healthcare system isn't set up for doing that.
Yeah. No, that's exactly right. That's what my ageless living lifestyle is all about. And what I've come up with, Robert, is to make it as simple and easy as possible. Again, you don't have to drastically change your lifestyle, but you've just got to learn how to improve because everything we do is habits, right? And so we just got to learn how to take care of the essentials. We need to breathe better. We need to learn how to eat healthier food and move our body effectively and get the sleep and reduce stress. All these things, and these are all things that we're already doing. I call them, the 7 essentials of life, but we never were taught how to master these 7 essentials. And so that's what I've tried to teach people. It doesn't have to be a drastic change. You don't have to beat yourself up, and the result is you're going to look and feel so much better and have so much more energy and live longer. It's just I don't know why it's so hard to convince people of that.
I totally agree with you, Rico. I think programs like yours are the solution. That's, we're not going to get it from a 7-minute visit with our medical doctor that we get
Yeah,
to see once a year, but it's more engaging with programs with yours, with coaching, with lifestyle messaging that people can really um, take control of their own life. If it's a different era, when a few years ago, patients basically just received information from their doctors. They told them what to do. They told them they were either sick or they were healthy, and that was their reality. I think that's changing now, and for the better. With programs like yours and others, patients are now taking back their health. They're taking charge of their lifestyle. They have agency. In other words, the great thing about lifestyle is I, as a patient, get to decide every single day when I get up what it feels, what food I eat, when I exercise, how when I sleep, when I have stress, when I meditate, when I how I have a sense of purpose. And these are, is the world a loving place, or is it a horrible, scary place? All these things matter. And as a person, sure, as a patient, I'm still going to pay attention to my doctor, and they provide valuable
yeah,
information. But I know as a medical doctor that my doctor will never have the insight into my own health like I do. In other words, I know things about my life as a patient that no doctor will likely ever uncover, just because there's so much information there. And doctors provide valuable insight, but it's a combination now with the patient controlling lifestyle and then the doctor adding input there. But if you control the lifestyle well enough, you're going to need less and less of the doctor.
yeah, absolutely right. Well, we've only got just a couple of minutes left here, so I know you agree. I think we agree that nutrition and food is really the biggest issue. I mean, exercise, you could just go out and walk and do a few basic stretches and a few things, and you could be okay as far as your movement. But food's a different story. So I know you like to say if you would just eat what your grandparents ate, you'd be doing real well. So just talk real quickly about what you recommend people, how they can begin to immediately start to improve their diet.
Well, for me, it boiled down to simple things that I recommend. Basically, stop eating all the time, which is what I used to do. So cut out between meal snacks, and even cut out meals if you want. I'm down to 2 or 1 meal a day. Basically, I eat when my kids come home from school. And then more importantly, that what to eat. Of the 3 macronutrients, I pretty much get rid of carbohydrates. So I get rid of starches, sugars, rice, grain, flour, all those sorts of things, because they stimulate insulin. Second thing is I get rid of junk oils that are harmful, seed oils that are processed industrial oils like corn oil, rapeseed oil, canola oil. These are pro-inflammatory, pro-oxidative, and they're in all salad dressings and they're in all junk
Yeah,
foods.
yeah,
They're hard to get rid of, so you got to pay attention. Last thing I do is I get rid of grains. And now I don't have gluten deficiency, I don't have celiac disease, but I believe that many adults, perhaps the majority of them, have a low-grade allergic reaction to the proteins in the grain, which drives low-grade insidious inflammation,
yeah.
which drives aging, which drives all these chronic diseases that I talked about, and metabolic dysfunction. So I avoid grains for that reason. Plus, if that's not enough, in the United States, of course, our grains are literally soaked in a toxic weed killer called glyphosate,
Yeah.
which is illegal in around 30 countries in the world because of its association with cancer and other diseases.
Well,
And
that's why
lastly,
I,
yeah,
I was going to say that's why it's so important to eat organic. You
yeah,
got to buy
yeah,
organic food. It's just
yeah. And lastly, grains have a lot of carbohydrate in them. And don't get me wrong, I am a recovering junk food addict. I love bagels, I love donuts, I love bread, I love all that stuff. But there's one thing in my life I love more, and that's my children. And
Yeah,
I'm willing to give it all up just to be around a little
yeah.
bit longer for them.
Robert, we're almost out of time, so tell people how they can get a free chapter of your book, Lies I Taught Medicals, and where they can get a copy of your book.
Sure, yeah. My books, first of all, at your local library, also at Amazon, Barnes and Noble, and your independent bookstores. If you want a free chapter, check it out. Go to my website, which is robertlufkinmd.com. And I'm very active on social media. My wife says too active, but please look for me there and say hi.
Yeah,
Love to hear from you.
we'll put all that information in the show description. We're out of time. Thanks you so much, Dr. Robert Lufkin. That was great. Thank you.
Thank you, Rico. It's been a pleasure.